So, Bismillah ar-Rahman ar-Rahim. I wanted to speak a little bit about something that was mentioned briefly in both of the previous presentations, which is about this concept of the integrative team. And it's something that the Khalil Center is working diligently to achieve. And a very core component of this is making sure that the clergy, I'm just going to use that term, the imams, the hafiz of the Quran, the person who does ruqyah, anybody that's going to approach treatment of what could be a mental illness or a mental health issue from the religious side, I'm going to call them the clergy or the chaplains, they should be part of the mental health team for a complete and holistic treatment of this individual. But that takes the acceptance of three people: the mental health professionals, the clergy, and then the community. These are actually slides that I've taken from another presentation that I do on mental health in prisons and prison chaplains as an integral part of the mental health team. So some things might not be particularly relevant to our presentation here. But what I wanted to talk about was about how we, the clergy, are first-line responders. Not really providers, sometimes providers, but really we're first-line responders. And why is this? Because congregants will seek out religious advice from the clergy. If somebody has an issue that they feel is spiritual, if they feel that it's physical, if somebody breaks their leg, are they going to go to the imam of the masjid? No. But if somebody feels like they're hearing voices, do you think they're more likely to go to the imam of the masjid or to a mental health professional? Let's be honest. Imam. And then what is that person going to say is going on? Jinn. And what is the average imam going to say? The average imam. It's jinn. And then what is he going to prescribe? Ruqyah, Quran, and so forth. And subhanAllah, very interestingly, within this last year, somebody came up to me, and it was a hafiz of the Quran who was asked to come in to read Quran to somebody. And he said every time he would read Quran, she would start going like this. Now, is that jinn? Does that sound like jinn to you? Could be. Do we believe in jinn? Do we believe in black magic? Do we believe in hasad and evil eye and jealousy? Do we believe in all these spiritual forces in the unseen and the ghaib that could affect somebody in the physical world? We believe that. But could it also be a mental health issue? It could. And that person is actually currently in therapy and seeking medication. And that was just a way that her illness was being exhibited. It had nothing to. Well, the jinn might have been there, but she's now being treated professionally. So Muslim patients will seek out their legal tradition. They'll try to see what is being said about jinn, about magic, or so forth, and they'll seek out the spiritual leaders. So why is this important? Because if they're coming to us, to the clergy, and in whatever capacity that might be, if they're coming to us first, it's very important for us to know where to refer out to. And if we don't know where to refer out to, then two things could happen. Either we just disregard the issue, and I'll give an example about that, or we say, I will actually treat this for you. I know somebody who was assisting this person. They were suicidal and dealing with very severe depression, and they even had hallucinations. Now, hallucinations is another thing. If you bring an explanation of a hallucination to a clergy figure, what might they say again? Jinn. Here we go again. Here's the jinn syndrome. It could be. Could it be jinn? No. And it might be jinn. It might be hallucinations. So with this person, they were seeking what they thought was therapy with somebody who was not only was he trained in Sharia and the Deen, so that he fit into that properly to that category of being from the clergy, but he also was not licensed to provide clinical care for somebody in the mental health or dealing with the mental health issue. That person said, get off your medication, whatever that medication was, and he actually did. So this is the danger where somebody a spiritual leader might now step outside of their domain into somebody else's domain. If they told them to get off your heart medications, here's some dua and get off your cholesterol medication or your heart medication, or you don't need a cast for that broken bone. Would anybody accept that? We wouldn't. But why is it that we allow ourselves as a community and our clergy leaders and the spiritual leaders, and we allow for that to be occurring in our spaces, in our masajids, on the phone, and so on and so forth? So now we're not saying that because we are first line responders, so to speak, we have to know how to refer out, and that's one of the things that Khalil Center does in the Imam training seminars that they conduct around the nation. MashaAllah, now it's how many times has that course been offered?
Four cities. 4
different cities. Where, but now the Imam, over 100 Imams, right? Over 150 Imams have taken this training. So the chaplains they're not the only ones concerned for the patient's spiritual needs, but they can contribute to a holistic approach to care. They can assist in explaining religious states, especially if it's now across cultural understandings. If a Muslim patient is being treated in a non-Muslim facility, you want the clergy there to be able to help explain what might very well be a spiritual state, or exhibiting something about their spirituality, or it's not, and so it has to be dealt with by the mental health professional. In most hospitals and administrators don't understand the role of the chaplains. Medical directors rated their position very low in the team, and this is another issue, that if the mental health care professionals, if they don't see the clergy and the spiritual leaders within the community as being first line responders and connecting with them, then they're losing that connection to the community. Because a lot of people, they'll come to the masajid, they'll come to the spaces, but they're not going to go to a clinic or hospital or someplace where they can get mental health treatment. And so if this bridge, if the clergy, the chaplain, the imam, the sheikh, the sheikha, the ustada, if they're not recognized by the mental health professionals, then they're losing that inroad into this whole subsection of the community that will never step foot in the mental health in the clinics. And I think it was something like the Khalil Center does an intake of asking, if this therapist was not Muslim, how many of you would not have sought out therapy? And it's over 90%. So there are 90% of the people who come in to get clinical therapy would not have chosen this if it was not in a space that kind of meets both worlds, where they're allowing the clergy in there to be religious consultants. They're also allowing the professionals to get the training they need so that they can understand the Islamic framework. And now we're part of this integrative team. So it requires the professional community. It also requires the community members, somebody that might need this help, to understand that I can go to my imam who's also going to be working with a mental health professional. And then, so there's all those three people, the individual, the clergy, and then the professional care, which at the Khalil Center we are working to make sure that this model is constantly alive and people feel comfortable in reaching out. So I mentioned about the example of the person who was not trained in either the deen or mental health, or was not a licensed clinical healthcare provider, and they told this person to get off the medications, which now they have stepped outside of their capacity. Even for imams, sometimes they step out of their capacity. And I'll give you an example. If a person has marital issues, who's one of the first people they go to in the Muslim community? The imams. Would we all agree? They go to the imams. How many imams are actually trained in marriage and family counseling or marriage and family therapy? Very few. What do imams get in terms of their training? Like what knowledge? What would we say? In their madrasas, in the mahdaras, in the universities, what do imams, sheikhs, sheikhas, what do they get in their training about marriage? The fiqh of marriage. The legal, which usually deals with what aspects of marriage? The contracts. How to get married, how to get divorced, and what's the bare minimum support that you have to give. and the dowry and then so forth. It's one of the longest chapters. When I was studying, I spent 7 months studying the rules of marriage. 7 months, from everything you can imagine, every legal issue that you can imagine. How many of those apply when a person's having a real marital issue? Very few. So when people come to me and they say, I'm getting ready to get married, I want to study the legal aspects of marriage, I say, no, it's more important for you to study the akhlaq of a Muslim, the character of a Muslim, because those aspects you're going to be dealing with on a daily basis. Hopefully, the only chapter of the legal side of marriage that you'll be dealing with is the contract, which you usually have a professional that's dealing with that. And then divorce, which very few, hopefully it doesn't end in that. But if it does, you also have somebody, a lawyer, a legal specialist in the Sharia that would walk that person through that. But now, why are we offering marriage and family therapy? Why do we feel, and then for the community, why do we feel that the imams are equipped to offer marriage and family counseling? Why do the imams feel that they can do that? So this is where the Khalil Center is really solving a huge gap in our community, where they're bringing the marriage and family therapists together. They're bringing the clergy together. The community is now coming in, and there's a team that's going to help them. Another time for, and this is not something that overnight I kind of figured out. A lot of the work that I've seen done over the years by Muslims trying to explain the proper understanding of mental health and the Islamic model and so forth has helped me. But when I first came out of my studies, I'll give you an example on waswasa. Earlier we were talking about OCD, obsessive compulsive disorder. Would we say that waswasa is a good translation for that? Or could be? Right? Waswasa, where a person does wudu and it takes them 45 minutes. Person takes repeats their prayer. You might have seen some Allahu Akbar, Assalamu Alaikum, Allahu Akbar, Assalamu Alaikum, Allahu Akbar, right? Over and over and over and over and over again. Now, in the books of fiqh where I studied about waswasa, they say the treatment for waswasa is to completely ignore it. Now, I don't know if that might or might not work, right? It doesn't? Okay, see? It doesn't. So, complete opposite. So in the books of fiqh, they says when you're dealing with waswasa, the only true cure is to completely ignore it. So now I actually dealt with somebody who had OCD. Now I'm opening up a little bit, Hi, my name is Rami, and I've made a few mistakes in my life. But in my training and my understanding of waswasa, you would tell the person, completely ignore it. You need to, this is all from the nafs and the shaitan, don't even focus on it. Not understanding the complexities of a clinically diagnosable disorder called OCD. So when a person came to me with a serious situation, and I would say, answer his questions, but he's now asking the questions over, I said, you just need to stop it. Just stop focusing on this and move on with your life. Now, alhamdulillah, that person was in the care of a professional. But imagine I didn't even know the details it was later on that I found out of what he was seriously going through. But if I had at that time had the Khalil Center and had this person walk into the Khalil Center and say, okay, what does the Deen say about this? Or this interaction that we just had right now, right? What is the modern or what is the proper treatment of OCD? Here we go. Now let's work for the holistic benefit of this person. So these are, and I'll end on one story where after years of working on understanding this, Ahmed is a name I'm using, it's not his real name, but he was in solitary. So one of the things that I also do is we run a foundation where we have a distance learning course and a reentry and rehabilitation program for prisoners. Well, Ahmed reached out to me, and he was in solitary confinement, which this is a pretty good representation of solitary confinement, about the size of your bathroom. And you're in there for 23 and a half hours a day. You don't see anybody else. And you're let out to exercise for half an hour by yourself. So when they say solitary, it's really solitary. You're by yourself. So he was in here for 14 years. Why? Because, and I know there's some gasps, there's people who have been in solitary for 30 years. If you want to read about the Angola 3, they were in solitary. One of them is still in there after 30 years in a situation very much like this. So he was in there for 14 years, and he reached out to me and he said, I'm I'm in here because they find me a threat. The prison officials find me a threat to the general population until I take my medications. They're not going to consider that I'm stable. But I'm not going to take their medications because of two reasons. One, they're non-Muslim doctors, so I don't agree with their diagnosis. I'm not having an issue that requires psychiatric medication. And two, the Quran and dua is enough for me. Now that sentiment of the Quran and dua is enough for me. Would we say that might be a pretty common sentiment in the community? Yes. I don't need medication. The Quran and dua is enough for me. 14 years in solitary confinement for refusing to take medication. So I told him, I said, I'm not going to make your decision for you. You have to consult the professionals. But two things. Don't take it as an Islamic stance that just because this medical professional is of a different faith, that he's automatically against me and my faith. He may be part of the system that's trying to sedate prisoners, which there have been cases of that in California. They found that where they were over-medicating people to kind of keep them sedated. I said, I know that exists. So I know there is an over-medication in prisons, but those professionals that assessed you don't automatically assume that they're against you. They may be giving you very sound advice. Two, don't think that it's just the Quran and the dua that's going to be enough for you, because there are issues that are biological in nature, and the use of medication could help rebalance those things, and this was discussed early on by the Muslims. So by me giving him the Islamic understanding, say, look, historically, look what the Muslims said. There is this idea of imbalance, a chemical imbalance. They would usually say, غَلَبَةُ الطَّبِيعَةِ, but an imbalance, and you can bring it back. And so it's not necessarily because of evil eye or jealousy or magic or jinn or some of the other issues from the unseen. So what did he do? He wrote the next time he wrote me back, he said, I've taken my medication and I'm back out into general population. But if I didn't have that training, and I didn't have the help of people like those in the Khalil Center, and also I sometimes joke, I said, I need to start a group that's people who are married to mental health professionals. So my wife, Dr. Rania, I get free advice. So I said I want to start a group for those who are married to mental health professionals. But, she's helped me understand a lot about the mental health the issues and what is the proper treatment of people in certain scenarios. So it was through this training and through this that I was able to alleviate this person's suffering. Otherwise, he was in there on a personal, like a self-sacrificing type of tragedy, where he's saying, I'm doing this because this is my deen, and this is my the way I'm going to explain or I'm going to live my Islam. But so we can help, but it has to be part of this integrated team, and that's why I see that the Khalil Center has now taken what has been done in various areas and throughout the last 3 or 4 decades, and now is concentrating the work and streamlining the process, and so that more people can benefit from it, and so that more people it can be replicated out. And I'll also end on another story, which was recently I met a man and I was telling him a little bit about the Khalil Center, and he's a physician. And so you would think that usually a physician, regardless of the subspecialty that they're in, they should have some understanding of mental health issues, right? Because they do a rotation. Every doctor will do a rotation, right? In psychiatry. So I mentioned to him something, and I said, a lot of people on the TVs in the Arab world, this is what I can speak from, just because I don't know what the preachers are speaking about in the other languages, in the other mediums. But one common thing that you'll hear is that they'll say, "Al-mu'min la yusabu bil-ikti'ab." Who's ever heard this? Al-mu'min la yusabu bil-ikti'ab. A believer does not get depression. Is that a good translation? A believer does not get depression. And this is blasted out on the airwaves. So if somebody calls in, and sometimes those are live callers, and they're describing how they're going through what they would say, I'm feeling depressed, I'm going through depression. They'll say, Al-mu'min la yusabu bil-ikti'ab. A believer will not be affected by depression. So what does this do for the person? Now the sheikh or the clergy or the sheikh or whoever it is telling them the believer will not be affected by depression. So what's the automatic thought process going to result in? I'm not a good believer, which is very dangerous. So my response to him is, I said, I used to entertain that possibility before, of course, I had the training. and that yeah, it's about spirit. That if you get on your deen and you know your deen and you practice your deen, all these issues will go away. Until I met a person who was a hafiz of the Quran and the alim of the deen, and he was clinically depressed, went through psychotic episodes of hallucinations, and 2 suicide attempts. Now, is anybody going to tell me that person who I have seen in tahajjud, and who one time, also another person who we were helping, we had to go through a very intensive intervention process, but he told me, he said, even when that person was going through was suicidal, they were still praying the 6 rak'ahs after Maghrib. How many of us might leave the 6 rak'ahs after Maghrib because, I got to answer that text message, or I got to get over here, and this person was going through a serious bout of depression to where he was suicidal, and yet he was still making sure all of his prayers were in, and all of his sunnah and nafilas were in. So I use that as a story because it's helped me understand that these are 2 separate issues. You might have somebody like Human was mentioning. You have the person who's in the awliya realm who's going through these same exact things, but they're able to deal with it with the resiliency that maybe the average person is not going to have. So in mentioning that to him, or just seeing that, and that was just a few days ago, there's a lot of work that needs to be done, and there's a lot of education that needs to be done. That if we have somebody who even is trained as a physician, is also a first line responder and provider, and yet has this belief, he said, no, I firmly believe that believers will not get depression. So if it's a chemical issue, or if it's hereditary, if it's genetic, we have to consider all of these things. So I'll end here, and it's just again, it's an honor to be here, and it's a wonderful view you have here, mashallah. I was just asking, is this the place where the Muslims get to pray all the time? I mean, this real estate is really, really like valuable real estate, right? Mashallah.